So, good morning, everybody, and again, thank you to all the workers, essential workers, and non-essential workers that are doing the right things, to the residents of Albany County doing the right things. Thank you, because we'll get through this together. As I always said, it's not a marathon, it's not a sprint. We got to just take our time and take a step back, and in a partnership, we'll get through this. But sadly, today, Albany County residents we had two more residents that have passed away. We talked about the one yesterday. We weren't sure. It came out in the governor's press release. So we got the information last night, and unfortunately we got the information that another resident passed away. Both were men with underlying health conditions, one in his 70s, one in his 80s, and both of them are from St. Peter's Rehabilitation and Nursing Center. So our thoughts and prayers go to the family, to the 122 family members that have passed away. Again, my condolences and my prayers for you and for the two new families. These are difficult times for the 124 people that fell victim to this COVID-19. It's not an easy time, and like I said, in the beginning it was even harder. Most people couldn't say goodbye to their loved ones or have a proper send-off, and now we can. Funeral parlors are doing the right thing. Keenan's Funeral Home, and I can just go through the whole list, and Mara and Cahoes, they're all doing great stuff, and they're making it possible, not in the large ways we used to do it, but in a socially distant world that you can say your goodbyes to your family members and have a little bit more of a send-off and have a few words with them. But it's tough. It's still tough losing someone in this time. But as of today, there's 2,168 positive cases of the coronavirus in Albany County, 631 people under mandatory quarantine. So as of today, we have an increase of 29. Now, again, we were alarmed in the beginning of this. You know, we hit the 8 packs, we went down, things were going right. The weather's, a lot nicer than it was 2 months ago, and we're starting to see that steady increase, which is what makes us worried. So, as of today, 5 of the new cases are linked to the Hudson Avenue party. So, 5 of them are now linked to that. And those who were either at the party or were socially gathering between July 3rd and July 5th, which brings the positive total numbers of the Hudson Park party to 33. We know that 12 cases involve healthcare workers or people who are in congregate living settings. Three of them are from people traveling back from their winter homes or just traveling to the states that we have deemed that if you come back, you have to self-quarantine for 14 days. 2 have close contact to a positive cases, and 7, again, was in a clear source of the infection. And I said that yesterday. That's the more alarming thing. More tracing and mapping goes into that. And like I said the other day, out of the 6 yesterday, 2 were traced back to the Hudson Park, and it's the same thing with these new 7. That's why I say to people, you're not going to get fined. You're not going to go to jail. We're not going to put your name up on a board and throw you in. It helps us stop the domino effect. It helps us stop the spread if you come forward and you tell us what's going on and who you are exposed to. These are the things that we have to worry about. And the other thing we're watching is now we have 91 active cases in Albany County. So that number's steadily been going up the last couple of weeks. 6,677 people have completed quarantine. Of those, 2,077 tested positive for the virus and have recovered, and we have 22 recoveries as of today, which is good news. The unfortunate news is the hospitalization, and that's the one we've been watching. It's a lot of the feedback I get on Facebook and from people in the streets. Well, people aren't being hospitalized, people aren't in the ICU. I'm glad. Like I said, I'm not a scientist. The data changes when you look at the CDC and you get guidance from the feds, the state, or doctors in general, because it's morphs. And one of the things that we do every day in the control room, we have our 1,400 meeting in the control room of what's going on in this region, that we watch the hospitalization. And General Murphy does a good job, and we talk about hospital beds and ICUs. But unfortunately today we've had an uptick, so we have 3 more people in the hospital, so that brings us to a total of 6 people. Still 1 person in the ICU, in which we reported 3 days ago. So as of now I'm watching this, is it having that effect where we're going to see more and more people start going towards the hospitals, which we hope it's not going to happen, and it's my prayers that it doesn't happen that way. But I need your help. I need you to roll up your sleeves, and I need you to work with us and get through this. And the only way we're going to get through this is by working together. and not blaming one another. You know, we can blame each other a year from now, 2 years from now, when the great universities come together and they decide who did what right and who did what wrong. That's when we can have the debate, but right now we need to be in this all together. Over the last 5 days, there's been an average of 14.4 new positive cases. Yesterday it was 12 for the week before that. So I'm encouraging everyone just to get tested. It's okay, you can get tested, and whether you have signs or symptoms, we're not charging you for insurance. If you don't have insurance, we're going to pay for it. State University at Albany, the New York State government's running that. That's free. The drive-through, the South Q Arena, that's free. They're not even asking for insurance, so take advantage of that, and please, by all means, get tested. But if you're going to go to the Albany or the South Q Arena, the number is 888-364-3065. And then our mobile testing sites that we have established early on here in Albany County, please, by all means, call this number also, area code 518-465-4771. Rite Aid and Colony, as always, that's the self-administered test. It's a little bit easier than getting a swab down your nose. That numbers are just, you've got to go on to riteaid.com, to their website. And as again, Priority 1 in Gilliland, 518-867-8040. And just remember, you know, look at socially distance, wear a mask, cough into your arm, clean your hands, and we're going to get through this. It's 4 basic steps. You know, we were taught as kids, right? You know, how to do this stuff. Not wear a mask, but now add that in, you know, to the equation. So, listen, I know everyone likes to be together. I know when everyone sees everyone, they like to hug their friends or their family. There'll be time for that. There'll be time for that when we get through this, but for right now, we need to continue to do it correctly and wear your mask correctly. You know, I talked to the health department and to Dr. Whalen's team about maybe putting, you know, posters out into all the restaurants and bars and delis and pizzerias to just show how to properly wear it for the workers. Because again, when you get there, they get tired. I get it. They just pull it down under their nose. They have it under their chin. You don't think about it, or you're trying to talk to somebody, and it is muffled when you're talking through the mask. It's muffled when you're talking to somebody and you want to hear them, so you pull it down for that quick second. So these are things that we just got to get used to, and different ways of doing anything. So the new stuff going on, and I talked about this for the last couple of weeks, but the guidance, more guidance we're getting for universities coming back, colleges that are welcoming students back this fall, freshmen that are coming in that are going to have a different experience in the freshman class before that, seniors coming back that want to enjoy their senior year and play sports because it's their last year. And for most of these seniors, you know, the sports is the last time they're ever going to get on the field as a team, playing lacrosse or soccer or football or baseball or basketball, field hockey. This is it for them. And it's that experience you remember, because I always get a big kick out of it when I'm sitting around the fire at camp with my brother-in-laws, and they talk about playing when they were 13 years old on a baseball team and what Bob did dropping the ball in the cross. I'm like, how do you guys even remember that? And they still wear their shirts, and they talk about their college days, which is nice. So I get it, but the world's different. Life on college is going to be different. Dorm rooms are going to be different. Their experience is going to be different than most kids. Sophomores that come in after having their freshman year looking for more freedom, that's going to change, you know, and the same thing with juniors. So I do want to thank our 2 presidents that are here from UAlbany and from Siena College, Dr. Rodriguez and Dr. Gibson. I like to call you Colonel, though. That's, you know, my Colonel. I can call you Major or General. I don't want to call you General. I don't need Major Shields or Murphy mad at me. So, but I do want to say it's a pleasure to have you 2 here to really talk about it, because that's the one thing we get a lot of questions for. And it's been a big question how schools are going to come back in the fall. And after sitting down with both these gentlemen and seeing the plan that you have of action at both, you know, UAlbany and Siena, I have to tell you, as a parent, if my kids were going there, I'd be very comfortable. You know, I mean, the way you've tackled it, the way you're going to address it, and I don't want to take any of your thunder away, but I'm going to let them talk in a minute. We also made arrangements with Siena College. We're going to be testing the international students that come in. We're going to be doing that in-house with our nursing staff, so if they don't have the insurance and what have. And one of the things that President Gibson came up with was how he's going to self-quarantine them for 14 days, get them tested again before the 14 days is up. I'll let him talk about it. I sat there and I go, wow, you really thought about this. But again, it's the new way of the new norm of us going forward. So President Gibson, I'll let you start.
Well, Dan, first of all, thank you for the opportunity and to be with Dr. Rodriguez as well, and deeply appreciate your leadership. We've known each other for a number of years, and I've always been remarkably impressed with your leadership, but more than that, I consider you a very good friend, and I thank you for that. I want to begin by also sharing my condolences to the families of those we lost, and pledge to them and to all the residents of Albany County that we understand how serious this moment is and how important it is that we are prudent with regard to our planning and very meticulous in terms of our supervision of the execution. So I know there are some concerns out there, and rightfully so, about what's going on in the country, the trajectory, and even though we've done very well here generally in the Capital District, as Dan has reported, concerned about some of the recent upticks. So where did the college come in? So Siena College, we've been working very carefully on this for a number of months, and we have a plan. We believe it is a smart, safe plan to reopen the campus and for us to safely, effectively implement our academic program. So as it relates to the risk, we are managing the risk along two general axes. There's the academic track, and then there's the residential life track. I talked to our students last night. We had a very well-attended town hall through Zoom, and I had an opportunity to speak to our students about our overall approach and what it would take to successfully accomplish this mission. And the way to think about this is it's a relationship. We have students and we have the college. And so the students are today receiving electronically a copy of their pledge. And in that pledge, it talks about the things that we want them to contemplate, we want them to think about, and then adhere to. And after they've done that, we want them to affirm by signing that pledge and returning it to us. And then on the college end, we commit to following through on our policies. And so when we talk about how we're going to do this, let's talk about the timeline, how this is going to impact. Because in a couple weeks' time, we're going to start to bring back students to Siena College. And as Dan mentioned, initially that those students will include international and students who are from out of state, from areas that are struggling right now with the coronavirus. We will comply with federal and state and county guidance, which means quarantine. So they will be met, they will immediately be put into quarantine, and we will implement that quarantine in strict adherence to what's been put out. And as Dan mentioned, part of that process, those processes are the testing requirements that come with that. So the residents of Albany County should know that these individuals, who you might describe as high-risk individuals, they will not be out in the area here in the county of Albany until such time that they have fully completed that quarantine and received negative test affirming that they're safe. So from there, we start to bring freshmen back 19 and 20 August. We're pacing all of our returns so that it doesn't overwhelm our system. And we bring upperclassmen back 21, 22, 23 August, and we start classes on the 24th. There'll be an orientation, of which that'll be hybrid. Some of the activities will be in person in small groups, and others will be via Zoom. But again, please know that, we've got a plan in place. That pledge is, asking our returning students, all our students, to test before they come, but it's more than just a test, because the test is just a moment in time, right? And it could give a false sense of status. So we also want our students to start living in accordance with the pledge even before they return, and to get into the habit of doing the screening. So when they show up on campus, they're bringing a copy of their negative test, but that is not alone enough to proceed, because we have 100% screening when the students come back to campus. And when they come back, they're answering the questions and getting a temperature check, and they're also, if necessary, being attended to by a medical professional. So look, unfortunately, if somebody shows and they either check yes or fail a screen with a temperature check, as we know, given the state protocol, the place to test and to trace is at the county level. So that may mean hopefully not, but it may mean for some of our returning students, they may have to go back home, because that's where those activities take place. So I want everyone to know as well that both the academic and residential track includes smart policies. Certainly everyone that Dan mentioned, but we're also doing deep cleaning of places of concern like dining facilities and dormitories. We're making sure we're doing that deep clean. For example, at the dining facilities is 3 times a day after breakfast, lunch, and dinner. We have spread out the campus. We've de-densified the academic track and the residential life. So, we envision a lot of students will be doing takeout. We'll have picnic benches set up. We'll have tent set up. There's also additional overflow in the student union, all of which is that we can practice safely distancing and complying with all the guidance. So, look, we've got contingency plans as well. If we start to see students test positive, we have plans in place there. We're going to do a tabletop exercise where we stress test ourselves at the end of next week so that all my key players, they have an opportunity, we get a chance to see ourselves. They'll be refereed by individuals who are not part of our planning process so that we can ensure that we've got the protocols in place to fulfill our end. I mentioned this is a relationship. I'm confident that if our students and the college comply with what our plans are, we will safely administer our academic program effectively, and by Thanksgiving time, be able to return our students back home having successfully completed the fall semester. I'll stand for your questions at the end, but at this point, I'll yield back to our county executive.
Thank you, President Gibson. And I also just want to remind them, one of the things that I thought was impressive, they talked about the time periods between classes, that they're going to extend that so they can go in and clean the classroom after a class is over with, so the next people that come into a fresh, clean room. So a lot of thought process and great execution of a plan. But Dr. Rodriguez, I want to say this: you've been a great partner here since you've been here. I was kind of chuckling because you have Jordan calls all the time, and I think of his old hat where I kind of cringe when he calls, but now I'm okay because I can just hang up on him now. But, but again, dealing with the 33 students, you've been on top of it. And look, you could have the perfect plan, and that's what's going to happen between these two great colleges. We are going to stumble, we are going to fall, and it's how we address that going forward. We got to pick ourselves up, dust ourselves off, and reapproach and continue to educate. These kids that are coming here are our future. They're our future CEOs, they're our future doctors, lawyers, business people, whatever field they decide to go into. They're going to make mistakes. They're kids still. At the end of the day, we got to remember they're still kids. And I know I've gotten a bunch of Facebook comments about people saying that to me. How do you talk to that age group? It's difficult. I have like I said, I have 2 kids in that age group, and you try to do your best. And it's the same thing here, setting the example with you, Albany and Siena, to have that foundation here in Albany County with the other great colleges, Maria and St. Rose and Sage and all that, and really sending this message together and working together. We'll get through this, and I want people of Albany County to know that these 2 gentlemen, these 2 great universities, really do care about the Capital District, and they care about Albany County. So, Dr. Rodriguez, please.
Thank you, Dan. Good morning to everybody. Muy buenos dias. And I really appreciate the invitation to join you this morning, and to our viewers. Thank you for joining us as well. Dan, it's a pleasure to be here. Thank you so much for the invitation. Thank you for the partnership, and thank you for all the great things that you and your staff do for Albany County. And these press conferences, keeping our community informed, is one of the primary strategies to keep our community healthy and safe. And so information is of critical importance, particularly in these days of uncertainty. So thank you so very much for everything that you do. And President Gibson, thank you as well for joining us today. And I would salute you. I was in the United States Air Force as well, and so I was not a commissioned officer, but so I have to salute you, right?
Like me, right? So we all make our mistakes, President.
But again, thank you so very much. I also, it's critically important, these relationships that we develop across institutions of higher education and with local government, with city government, county government, and state government, and federal government is critically important as we move forward. This is, as you all know, a global pandemic with global implications, and Albany County is not exempt to all the impacts that this has had in terms of the loss of life, in terms of people being hospitalized, in terms of the illnesses that we suffer as a consequence of COVID-19, but we have also responded very strongly as a county to COVID-19, and we should be very proud of the ongoing effort and the work that everybody has put together. We have, the University at Albany has been also working very closely with Albany County Health and Commissioner Whalen. Since we got our first case of COVID-19 back in March, we have been working very closely and keeping in tabs in terms of what we need to do, how do we move forward, how do we collaborate. And this has really had major implications for institutions of higher education. On March 13th of 2020, the lives of our faculty, staff, and students was turned upside down when we had to go basically overnight to remote education, right? And this was a huge effort on behalf of our faculty, our staff, and our students. And we continue to move forward to try to reopen as safely as possible in the fall of 2020. We established a COVID-19 task force, UAlbany Forward Together, that has been working extremely hard. And this is a task force composed of faculty, staff, and students working together and preparing to reopen, although we never closed, but let's say for now, reopen in the fall. And I'm extremely proud of all the work that they have done to ensure two things. Number one, that we provide for the health and safety of our campus community. And number two, that we provide our students an excellent education and excellent educational experiences and other student life experiences at the University at Albany, given the circumstances that we are confronting. We prepared a plan that we submitted to SUNY following the state guidelines and which was approved. And so this plan, which is a very strong plan, I could say ditto to what President Gibson said in terms of what they're doing, because we're doing the same things. We start our fall semester on August 24th. Of course, students will start moving in a week or so before. We will complete our campus instruction before Thanksgiving, so once students leave for the Thanksgiving break, they will not return to campus until the spring. We will conduct robust health surveillance, testing, contact tracing efforts. All our students will have to be tested prior to arriving to UAlbany and show proof of a negative PCR test. They will be required as well to quarantine for 14 days. And so that allows us to establish a baseline once students arrive on campus so that we can then follow strict safety policies, including face coverings, physical distancing, hand hygiene, cleaning protocols, and testing when necessary. We will also focus on reduced density, that is, reducing density in all public spaces, including in our classrooms, in our campus center, in our libraries, and in our residence halls. We will have a multimodal instruction. At this point in time, although these numbers keep changing day by day, about 57% of our courses will be fully remote. 15% will be in a hybrid, that is, combination between face-to-face and online, and about 28% of those courses will be in person. And these will be small courses that would allow for physical distancing and reduced capacity classrooms. We already began the process of resuming research activities on campus, so we're phasing that in a very safe manner. We're following the state's telecommuting policy to reduce the number of employees on campus, and we will continuously reassess conditions and pivot back to a fully remote model if needed. Of course, we will follow Albany County protocols, CDC protocols, state protocols, as well as SUNY guidelines and federal guidelines to make sure that we continue to operate in a way that ensures and tries as best as possible to ensure the health and safety of our campus community. That is of paramount importance. But at the end of the day, we also want to provide a truly excellent education to our students, and really working with our students to make sure that they abide by our guidelines and policies. Just today, we released a student guide that is sent to all students regarding what we expect from our students in terms of testing, contact tracing, in terms of health and safety protocols on campus. That has been distributed to all our students. We also provided a guide to our faculty in terms of instruction and how that will take place. So this has been a very iterative process, a very dynamic process, which continues to change depending on the circumstances, not only in Albany County, but across the state, indeed across the nation and across the world, because we have about 10% of our students that are international students. But I could say with a high degree of confidence that our faculty, staff, and students have been working incredibly hard to ensure that we develop the best mechanisms possible, the best strategies possible to ensure that we work closely with our local communities to ensure the health and safety not only of the UAlbany community, but of the surrounding communities, because we are part of our surrounding communities. And so we will continue to do everything in our power to ensure the health and safety. Again, we will continue to monitor local, state, and federal guidelines and new recommendations, and we will be modifying or rearranging our plans depending on how things change. So with that, I'll stop here. Thank you, Dan.
Thank you. You see the passion between the two of them. And again, you know, they know the serious that's in front of them. They know how to tackle the issue. And to President Rodriguez, I just got to say, who's been dealing not just with the mobile testing going on, the drive-through at UAlbany, who's done a great job out there, and the Seth Q and essential workers and all that. And then also dealing in and working with us on our mobile testing about the underlying effect it's having in certain communities. I can't thank you enough for your leadership. It's probably what you didn't sign on for when you took the job here. But again, everything changes in the world we're in as we reimagine. And I'm going to have a couple superintendents on next week. And as I've talked to the schools here locally, and parents here have issues with the school districts or how they're going to do this safely. This is two prime examples that really, I have to tell you, have showed their leadership, not just as the presidents of these universities, but to the board members and to the staff and to the professors, to everyone at them, to right down to the janitor, who are going to make sure this happens. It's an all-in effect. This is all hands on deck. This is all everyone rolling up their sleeves, because everyone's in this together. And that's what I said to you. You know, we can get through this, but we have to get through this together, working together in a partnership. And I know someone did say, they go, do you realize how many times you say partnerships? And I said, yes, I do. Mm-hmm. But without a partnership, we can't do this. And we need your help to make it right. So again, I want to thank the two of them for coming here and explaining how it's going to be done. We did get some questions with kids coming back, international students. Look at, you know, they're going to self-quarantine, they're going to do the right thing, and you can see what happens just, you know, if they don't. So trust me, we're going to be on top of this and changing things as we go forward. But as always, we have our mental health hotline available 7 days a week, 8 a.m. to 5 p.m. Please, like I've said before, don't be embarrassed to call. People handle stress differently. Some can handle it, some can't. You know, it all depends on how you can handle situations in your life with things being thrown at you. I have a friend that, you know, the stress level's not that well, you know. But again, it's all how you deal with it. And you got other people that you can, you know, run them over with a car, and they're going to be like, "Hey, I'm all right," you know. I mean, it's just the way it is. But we're there for you, and that's why we set this hotline up the second day so people could talk to them. So please, by all means, call it 518-269-6634. As always, too, we have our 24-hour sexual assault hotline number, area code 518-447-7716. And as always, the New York State hotline in the 211. Again, thank you.